Hi everyone, my name is Casey Glasser and I'm going to share with you a bit about my study, the Gender Diagnosis Gap. Women seeking medical care are often told that their concerns are misguided. Heart disease, gynecological cancers, and other medical conditions are dismissed as mental health problems, such as anxiety and stress disorders, quite often. Perceptions of women as emotional and fragile may cloud doctors' judgments as they make their evaluations. This leaves women without the medical attention that they may desperately need. The objective of this study is to examine the relationship between implicit bias that is held by doctors and the misdiagnosis of young women. In addition, it aims to gain insight into the ways in which misdiagnosis alters the degree of trust that women have in their doctors. Through an analysis of women's perceptions and experiences of misdiagnosis, I explore the ways in which doctors' implicit gender biases impact the accuracy and timeliness of the diagnoses that women receive. This study joins an ongoing conversation within the field of feminist studies on gender inequality within healthcare. This phenomenon is often referred to as the gender health gap. My study focuses on one aspect of this, which I call the gender diagnosis gap. So the central aims of this study are firstly to explore the relationship between implicit biases in medical professionals and the misdiagnosis of young female-identified patients. Secondly, I aim to discover how experiences with misdiagnosis can impact the future of the doctor-patient relationship. And thirdly, I make policy recommendations for legislative intervention. So I conducted a qualitative survey of 21 young women ages 19 to 25 years old. A few of the questions that these women were asked were, did you ever feel talked down to by a healthcare provider? Did you ever feel that your identity played a role in how you were treated by healthcare providers? Did your experience with delayed or misdiagnosis change the way you felt about your doctor? And finally, did your experience with delayed or misdiagnosis change the way that you viewed all doctors? So some of my major findings, well, first, 81% expressed that they had felt talked down to by a healthcare provider. 85% felt that their identity played a role in how they were treated by healthcare providers. Gender was cited most often by my participants, followed by age, race, and then class. However, it's important to note that the majority of my participants were white, so it's likely that with a more diverse participant population, race may be cited more frequently. 90% responded that their experience with delayed or misdiagnosis changed the way that they felt about their doctors. 70% responded that their experience with delayed or misdiagnosis changed the way that they felt about all doctors. Some even described changed thoughts and behaviors upon visiting doctors, such as overemphasizing symptoms or an overall reluctance to seek help from a doctor at all. So to combat this, I propose that we take some public policy action. So California has already taken the lead in fighting to eliminate bias in medical professionals. California State Assembly Bill 241 will require all physicians, nurses, and surgeons to attend continuing education courses on implicit bias, and this will start in January of 2022. I argue that a federal expansion of CAAB 241 is necessary in order to mitigate the effects of implicit bias within medical professionals nationwide. I concluded the survey by asking participants what advice they would like to give to women who may be in the same situation that they found themselves in. So I'd like to end my presentation today with a few words of wisdom that my participants gave. Be powerful. It is your health and your body, and you should never let anyone make you feel like your concerns aren't valid. Question everything when something doesn't feel right, and don't be afraid to be assertive. Too often, women are seen as emotional and anxious when they often have physical issues. Don't let anyone label you as such, especially when it comes to your health. And lastly, don't stop advocating. Your pain is real. It is a long and difficult road to finding a doctor who will believe you, but they exist. They are out there. Thank you so much for your time.